Amali said Liberating the Curriculum is this pan-UCL initiative looking at widening participation and celebrating diversity. And what we've tried to do in the medical school is to map where our LTC parts of the curriculum are, and to try and give our medical students, I see we've got a King's medical student here, so it'll be interesting to see what he thinks, and we've got a UCL student panel shortly, but we've tried to demonstrate to the students that it isn't all about middle class white men and women. There's all kinds of different ethnicities, there's all kinds of different sexualities, etc. So what we try to do is give our medical students a flavour of what life is like and what kind of patients they'll see when they become clinicians. So I just wanted to pick out one or two things in the curriculum. So the students will talk about the mapping exercise, but I'll give you a flavour of some of the sessions that we have in our curriculum. So in year 1, we've got quite a few sessions about mental illness and stigma. We've got sessions about understanding your own personal and professional values. We've got visitors, patients who come in. Many of them have got infectious diseases with stigma attached, like HIV or TB, and they talk to the students, and the students get to take their first clinical history. We've got sessions on non-compliance, non-concordance with medication. In year 2, we've got some issues, we've got some sessions about communicating with adults without English as a first language, communicating with people with hearing issues and communication problems. We've got sessions on substance misuse, abortion and conscientious objection, assisted dying, dementia, and then we've recently added a really interesting session from a GP who works in Hackney, and he's guested on our course, and he talks about shame and shame as a doctor. And one of my interests, one of my doctoral interests, is resilience. So we've brought a session in about how medical students and doctors can protect themselves. And about resilience. And then in year 4, we've got some sessions on homelessness and health. We've got sessions on withholding and withdrawing treatment. We've got sessions on all kinds of mental health issues like schizophrenia, and we've got sessions on capacity. In year 5, we diversify again, and we've got sessions on autonomy, domestic violence, sexual violence, female genital mutilation, and human rights. And as I said before, we've got these patient pathways running through our curriculum elsewhere. So I'm just giving you a flavour, really, of some of the aspects in our curriculum where we're trying to diversify and widen participation.